Hey, how's everybody doing today? My name is Mike Polascik, and I'm the head athletic trainer at Jacksonville State University. And this is
I'm Dr. Chris Clark, and I am the program director for the Masters of Athletic Training program at Jacksonville State University.
Look at those pretty guys down there in Florida.
What's up, Ed?
What's going on? Yeah, I don't know. It looks like I'm having a Safari issue, but it looks like I'm in here on my Chrome. Looks like Chrome is okay. Safari not so good. So yeah. So we're here. It's Abe Daniels. Hey Abe, what's going on, buddy? We'll give everybody a minute or so, and then we'll kind of get started. So.
Hey, Ed, I'm going to send you our slides real quick, if that's okay. So you can have that posted up there. I'm kind of can't really figure that one out, to be honest with you, bud. What's Texas like right now?
Cold and dreary. I don't know what the heck's going on. It's supposed to be about 1 billion degrees right now, and it's pouring out. I have no idea what's happening. It's the apocalypse, but you know what's going to happen is that it's going to get so hot and so humid that we're not going to be able to stand it. Do you want me to share these slides with everybody?
Yes, sir.
Oh, okay.
And that's just kind of a little bit of our data from the study, and just kind of giving everybody an idea of what we're going to present fully at the NSCA in July.
Okay, awesome. All right, I'm going to share. So I'm going to share that PowerPoint with everybody. That's okay.
Yeah. That's fine.
Yeah. Okay. Sharing now. All right. Cool. All right, everybody. Well, let's get started. Very special BFR Tuesday. You know, every once in a while we can coerce people to come on and talk about their stuff. So I've got 2 individuals who I'll let introduce themselves from Jacksonville State, and we'll be presenting on some research that they've done at the National Strength and Conditioning Association conference in a couple months, but we get to see some data now, and this is really cool. So Chris and Mike, you guys want to jump on and do a little, I know you kind of introduced, but some other people have come on. Why don't you do a little intro?
Yeah. Okay. My name is Mike Polascik. I'm the head athletic trainer / director of sports medicine at Jacksonville State University in good old Sweet Home, Alabama. Primarily I cover football as well as supervise all our 16 other sports on a daily basis.
Good deal. Thank you, Mike. My name is Dr. Chris Clark, and I am the program director for the new Masters in Athletic Training program at Jacksonville State. We began this fall, in fall of 2020, so I oversee the program. We have six students, and we're really excited about this study and how this will help Jacksonville State tremendously. So we're very excited about it.
Yeah, very cool. Yeah, Chris, if you need, I instruct in one other master's program for athletic training. So if you ever need anybody, do a little guest lecture or something, let me know. I love
awesome. Yeah, we could definitely work that out if you'd be interested. Yes, sir.
Yes, sir. All right. So awesome. So I've got a few questions. Usually how I start these BFR Tuesdays, if people haven't been on here, really this is a forum for people to ask questions versus, I mean, I do get a lot of questions in email and on social media and stuff, but this is a way that I can kind of talk about those questions and then I share it. So this goes on my BFR University website. It also gets sent to the 500 and some odd people that registered for this webinar. They see the replays mostly because we are during the middle of clinical hours. And then it also gets posted on my YouTube channel, which is just Acl Cara. And then the 11 or 12,000 people in my database get sent an email twice a month on a newsletter, which basically is whatever research has come out, whatever I think is kind of interesting, good articles, because I know people get tired of me talking. And so I get information out that way. So awesome. So I got a couple questions here. First, Caroline, hi Ed, I received my smart cuffs and I've set up the LOP for arms and legs too low. I've also downloaded the app. Okay. However, I feel I need some personal instruction on getting started. Is this part of the program? Typically not, but I'm happy to jump on a call with you and just get you started. I'm still updating the app. The app is our Smart Cuff Academy app. So when you get a set of cuffs, you automatically get registered. At least you should. We've been having some bugs, but you should get registered for the app. You can download it, and then it takes you through a 3-week on-ramp for BFR. I have to update the new Gen 3 cuffs, because before it was with our old Doppler and Gen 2 cuffs, but that's coming. But the exercises, I think there's a 3-week exercise program. And so, yeah, so that helps people get kind of oriented. Of course, we have live training. We have a virtual training coming up for BFR Level 1 coming in June. And then my all new Level 2 course, which will be performance-based BFR, I'm going to launch in July, which is all going to be online. I think it's 6 Tuesdays, an hour to an hour and a half each. So that way it's a little bit easier to consume. So that'll be coming up. Let me see. So how cuffs, Thomas asks, can you explain how cuffs work out my rhomboids? Yeah, so we have 3 different effects from BFR. When I put a cuff on my arm, I've got the primary effect, which is distal or away from the cuff. That's what's going to get the best benefit. So when I put the cuff on here and I do bicep exercise, I do wrist extensor, wrist flexor, I do tricep exercise, that's going to get the biggest benefit. Second benefit is proximal to the cuff. A lot of that is due to pre-fatiguing the arm, so that forces my shoulder to work more. The other thing I get is called a systemic effect. So when I put the cuff on, I create a hypoxic or a lack of oxygen environment. My brain registers that, and I get an endocrine response, I get a paracrine response, and I get other mechanoreceptor responses within the tissue that is signaling to the brain. So distal response, proximal response, and a systemic response. And a really cool in the rehab setting is a crossover response. So I exercise this arm. This arm gets a benefit, even if I'm in a sling or a cast or something else. That's the crossover effect, or would be part of that systemic effect. So you get all 3. So if you're really trying to work your rhomboids, what I would recommend doing is pre-fatiguing this arm as much as you can, and then forcing those rhomboids to work really hard. If you go on my YouTube channel, I've got a couple exercises that are my favorites for the rhomboids, like a prone like almost Superman, not including the lower back, because I think it's too much compressive forces for the lumbar spine. And then you go up and over the top. You can do rowing, you can do, whatever you kind of like to do, but that's how I would work rhomboid. Thomas, how often do your football players use BFR? So Mike and Chris, you guys might want to answer this. Like, how often are you guys using BFR? And it really is going to depend on what macro and micro cycle that they're in, is I'm assuming what you guys are going to tell me, but I'll let you guys take it from there.
Yeah. Hey, Thomas. So at JSU, when we started the study, it was in our off-season strength conditioning program. And if you look at the slides, you can see the program we use. We use it twice a week, one for upper body, one for lower body. And what we would do is we would alternate our compound Olympic lift week to week with our accessory lift. So we would use a non-linear undulating periodization where you're alternating the intensity day to day, and you're using it in conjunction with BFR so that you can kind of create a more hypoxic environment. It's way less load. If you see week 1, we only use 20% in our strength and conditioning program. And then when we got to week 3, we used 30%. So it's really low loads. And it's really high reps. I mean, you're doing 75 reps total with a 30-second break in between. So set of 30, 15, 15, 15. And that's all being done with a 30-second rest and having the cuffs on the entire time to really stimulate that HGH, that new blood flow, increasing that cardiac output throughout the workout. And we also we use it a lot in recovery as well. We would use BFR with, for instance, if we're on a Sunday and we played on a Saturday, we would use it as a recovery, having both cuffs on the lower body for an athlete for occlusion time of 5 minutes, and then at 100% LOP. And then at the end of that, we'd release the air and we'd cycle through the next person. So we use it a lot of different creative ways. I feel like, and that's kind of what this study shows, Thomas, is that we were trying to come up with something that's never been done before, and that's what this study shows, is that we can use this in conjunction with our off-season program to increase a 1 rep max.
Yeah, so explain to our audience why do you think, like, this is all being done with healthy Division I football players? I mean, cream of the crop, right? Like, why would you want to use light loads with that subset of athlete?
Well, I think there's 2 reasons. One, you're looking at it from the standpoint of, okay, in strength conditioning, the foundation of strength conditioning says that, okay, to increase power, increase strength, you have to decrease volume and increase intensity. Well, this is doing the complete opposite. We're increasing volume and decreasing intensity. And the cuffs create that hypoxic environment to increase cardiac output. So your heart rate is going up into the 160s right out of the gate. So the rest of your workout, your heart rate's high, versus when you in a traditional weight room without the cuffs, you usually take maybe the second or third exercise so you start getting up in those levels. But I think it's, in my mind as well, I feel like an athlete can't start this program and go like the first 2 weeks and they start to plateau, they start to get used to the workout. Whereas in our microcycle here that we did in our study, our guys couldn't get used to it. And then also, if you look at our Thursday was a lower body day. It was the last day of our strength conditioning for that week. So not only are we increasing strength, increasing power on that day, but we're also recovering faster. So when we hit Monday of the next week, guys are able to hit velocities and get better reps versus if they didn't, in my mind, Ed.
Yeah, I think, well, before I make any comments, Chris, do you have anything to add to that?
No, I think kind of what Mike was saying, and I think you're probably gonna hit on that. I think the aspects of how that makes the functional aspect of the player, the recovery time, the functional application on the field, all those techniques contribute to making that person better. And when you're in any kind of field, whether you're an athletic trainer or you're a strength and conditioning coach or whatever, that's kind of your goal, is making your players better. And I think Mike and I have both come across how this really helps improve a lot of factors in how they perform better.
Yeah, I agree. And I think for me, being a little bit more from the rehab side versus the performance side, for me, it's about injury prevention. It's about durability. It's about preventing, old school injuries in the weight room, trying to lift more weight when I want to be a better football player. I never, like, when I got to St. Mary's College of California, they brought me into the athletic training room to do their ACL rehab and their spine rehab. We had 13 active ACL injuries that I was rehabbing. And pretty much the whole women's basketball team had either a stress fracture, multiple level disc herniation, and it was all based on old school thinking from the strength and conditioning side. And the two sides, athletic training, sports medicine, wasn't speaking with strength and conditioning. Strength and conditioning just wants to get bigger, stronger, faster. I want to keep people durable and in the game, right? I don't want to hurt somebody. It's dumb to hurt somebody in the weight room, in my opinion. Like, they're not there to be a bench presser. It's different if you're working with Olympic lifters or power lifters or something. So anyway, for me, it's like, if we can use light loads, we can improve their repair, we can improve their recovery, we can increase growth hormone, we can do things that you can do with high intensity exercise, absolutely. But you can allow that nervous system to kind of undulate a little. It's almost like an off day, really, physically, even though it's not an off day mentally, but you're not causing central nervous system fatigue, is what we know from BFR. I can keep people healthier. I would love to see a long-term study with heart rate variability and seeing, like, can we maintain this readiness for athletes? I know a lot of people at the pro level They're using it because they can't stress their athletes in the middle of the season. If you're a basketball player or a hockey player, I mean, you're playing every other day. Like, how do you keep somebody healthy? A baseball player that plays 162 games, I think it is now. I don't want to be in their athletic training room. I don't know how they do it. I don't know how they keep them healthy. And be ready for the playoffs. Be ready to win a championship if you make it to the off season. Like, I don't know how they do it. They're amazing individuals, and they don't get enough credit. Because yes, they're phenomenal athletes, but we all break down. So anyway, I'll get off my soapbox. But I think from my side, and I'm totally on board with you guys are saying, is that if you're going to get the same amount of adaptation or very similar, without the risk for injury. It's the same reason why I say don't use a 1 rep max on people if you don't have to. Use a 3 rep max, use a 5 rep max. It's close enough. We get a 1 rep max just for ego. I hit the 1,000-pound club, I hit the 1,500-pound club, big deal. Be a better football player, be a better wrestler, be a better basketball player. Let's stay injury-free, out of the athletic training room unless we have to be there. It frees up resources, it frees up the AT, it frees up the athlete to study and do the things that they need to do. Anyway, yeah. So why don't you, can you share, do you want to share your slides and kind of talk a little bit about your study and what you found?
Yes, sir. That'd be great.
I'm going to say our study because I'm on that paper and I'm proud of it. And I didn't do nearly the work you guys did, but I get to ride your coattails. So our study, where we're going to present here shortly.
Yeah, so our study took place starting in June. We used our Jacksonville State student athletes were the participants in our study. And it's during the heart of COVID. Everybody's trying to get back during the Division I, Division II, all NCAA sports are trying to come back and get ready for that fall season. And we started with 32. Sorry, I missed a slide. So kind of like
I'm sharing it because I don't see the slides. Am I missing it? Share your screen on the bottom. Start sharing. Should be right next to your camera.
Can you see my screen now?
I don't see it. Oh, there we go.
It looks like it's trying on our end. Are you guys getting it?
You probably have a slower Wi-Fi. You're probably doing Wi-Fi versus a connected. I'm connected, so if we need to, I can share the slides. But you're starting to get it.
Yeah,
like it's
yeah, Eric, if you don't mind sharing the slides, and I'll just kind of hit on them real quick.
Yeah, just tell me when you want to switch them because I won't be able to see. But I'll let me open these up and I'll share my screen.
Okay.
Let me see if I can answer this. Do you use leg cuffs for speed drills like 3-cone or parachute? Yeah, it's a good question. So you can do what Mike alluded to before was you can do pre-event or pre-activity BFR. It gets you primed, but it also, like if we use something called ischemic preconditioning, which is very high pressures, 80 to 100% LOP, 5 minutes inflated, 5 minutes deflated. You do that for 3 to 5 rounds. It's been shown to prevent exercise-induced muscle damage. So if I'm doing a heavy plyometric day, I might use ischemic preconditioning to improve recovery because it'll improve the body's ability to repair and also prevent some damage during that high intensity exercise. I don't use our cuffs for plyometrics. Number one, it would be way too painful because our cuffs are truly occluding. Other cuffs you'll see on Instagram, they're using a bladder that has gaps in it. And so you're not really getting true occlusion. So you're not creating that hypoxic environment. And when I think of speed drills, that's what I want is speed. Cuffs will slow you down. So there's no reason to use the cuffs during speed drills, in my opinion. Now I could be talked out of that by people that are much smarter than me, like that are on the screen below me. And if you gave me a good reason, I might say, okay, that makes sense. But in my little mind, what I'm thinking is that I use the cuffs prior for a warm-up. I use the cuffs prior not to fatigue, but to get things primed. And then I do that speed work before I go into my heavy lifting. That would make sense to me. But you don't want to slow down the nervous system by creating early fatigue or peripheral fatigue or central nervous system fatigue, and then go into something that you're trying to train and overtrain in order to get speed effect. Any comments on that, Chris or Mike?
Yeah, that's our next study, Ed. Is our speed study. We're gonna knock it out.
All right, I'm gonna share my. So hopefully that makes sense, Thomas. And so when we do a warm up now, if you would have asked me 3 years ago, would I use BFR as a warm up? I would have said no. And the reason is I didn't want to pre-fatigue peripheral, which is what you're doing with BFR. You're creating a hypoxic environment. You're creating fatigue of type 1 fibers. I got talked out of that by the strength and conditioning coach at the Detroit Lions. We had a conversation. This is why we drink beers and stuff after conferences, because we talk about this stuff. And what he said to me was, well, if you're trying to recruit type 2 fibers and get them primed, why not do it, but not to failure? Why not use BFR to do a warm up, but just not do your normal 30, 15, 15, 15. Do like 2 or 3 sets of like 10 reps, very light loads, 20% or less, body weight, glute bridges, monster walks. And I'm like, oh, that makes sense. And then Stanford University was using them as a warm up as well. And so it just got me thinking, like, that makes total sense. Like, let's warm up. Let's not get tired. Let's not fatigue it, but let's warm up. And so I've changed my tune, which I'm very apt to do, especially when smart people are telling me things that they're doing, because I love it. I love learning. Okay, so here we go. I'm going to start sharing my screen, and I'm going to do this slide. So I'm going to go from here. Okay, I think you should be able to see that now.
Yes, got it.
Okay, just tell me when you want me to advance, because I can't see you guys now.
All right, so just with that first slide, I'll just kind of start it off. So obviously, and Mike's kind of mentioned some of this, but just a refresher for everybody. So we did it with our football athletes at Jacksonville State. Used a nonlinear undulating periodization program. It was a 4-week microcycle, and our basic purpose of this study was to evaluate whether BFR method in conjunction with a 4-week off-season nonlinear undulating periodization strength program would increase a 1 repetition max in the bench press and the back squats. All right. So that's kind of the general purpose of the study. So Ed, if you could kind of advance the screen there to the next one. And I'll just kind of continue with the participants. So the participants was the Jacksonville State University football players. They were aged 19 to 23. And our participants were required to have at least 1 year of prior participation within the JSU football strength and conditioning program. We thought that was very important for the results of our study. So you see a little chart there. Like Mike mentioned earlier, started with 32 people. Because of various circumstances, it kind of went down to 18 that completed the study. So that was kind of our participants. So Ed, if you can go on to the next one there. And Mike, I'll let you kind of take over from here, sir.
So if you're looking at this is kind of like our 4-week program, okay, from everything from percent to reps to intensity, and the day of the week we did it. Kind of like I said earlier, Friday was our off day, so we had Friday, Saturday, Sunday off, hit it back Monday. So Monday was our Olympic lift, explosion, power day, with power cleans and front squats. And then Tuesday, we would go to bench press BFR, and you see we're using 20% of that 1 RM. And then the accessory lift with that was the skull crushers. Now, keep in mind, these are just the main exercises we used in the study. There was actually some additional stuff, but it was kept the same format throughout. So, and then Wednesday was kind of more mobility, accessory lift day. And then Thursday would be BFR back squat, the lower body, because in our minds, we were using that BFR lower half to kind of help recover our bodies faster. And keep in mind too, on Tuesday and Thursday, for Tuesday upper body, we're using 50% of the LOP. And then on Thursday, we're using 80% of the LOP. And all the LOPs were taken prior with a PPE prior to the study. So that was a couple days before we started. So we used those LOPs throughout the duration of the 4 weeks. And then if you're looking at the week 2, you see how we change. So we go to bench press, 4 sets of 8, working off of 65% 1RM without BFR for bench press that day. But then we use BFR after that lift with our skull crushers, using that 30, 15, 15, 15, and using 10% of our 1RM bench press for that intensity. So, and then you go down to the back squat day, you see we're using 4 sets of 8, we're using 65%. And then we use hip extensions. So we'd have our athletes put their, we do a double leg hip extension with the feet on the bench, back on the floor, locking their legs out and lift their hips up to strengthen that hamstring to increase our back squat at the same time as we're covering that lower body. And then it changes then, and then we go back to BFR with, but we change the intensity to 30%. And then we go the back squat, it was 30%, and then we alternate again with regular bench press. It was 5x5, 75% 1RM. Then we use BFR skull crushers. We increase into 5% with the BFR on that. And then on Thursday, we would go the back squats 5x5, 75% 1RM, and then we use BFR for the hip extension part. So you see how we kind of change week to week, and the intensities and reps are going up and down throughout this microcycle. All right, Ed, you can hit the next one. Okay, so for this study, what we did from a validity standpoint is we used a 3D camera, Elite Form. If you're not familiar, it's a velocity-based training system out there that is phenomenal. I mean, this thing does everything from counts reps to sets and tracks everything from power, peak power, velocity, peak velocity, volume, work. And it kind of really helped our study from the standpoint of, 75 reps for a back squat, that's a lot. We wanted to make sure the guys were doing all the reps and sets, as well as we used it as a way for us to kind of help point us in the direction of the next study with this system. And I can't say enough about Elite Form. Skip at Elite Form, their CEO has been phenomenal, sponsoring our study, and it really made all the difference from a validity standpoint and helping us know which direction moving forward. So for instance, the picture you see here is a peak power of the bench press BFR from week 1 to week 3. So, we had a 41.11% increase in power from week 1 to week 3. So, that in my mind is just, whoa, like kind of jump and that's going from 20% to 30% of intensity. I mean, that's just insane to kind of see that data right there, and kind of validate what we're doing and increasing power from that standpoint. Okay, Ed.
All right, you got that. So yeah.
This is our average power of back squat BFR. Now, granted, there were some changes in this one. I think this number is actually higher, but it's using the people the whole 32 in this. But I would say you're probably missing 10 guys off this based on having a limitation to where they could not participate. But still, I mean, that's, you're looking at from 397 to you're going up 100 watts, 20% change from in 3 weeks is pretty incredible. Okay. So you can talk about this part.
Why don't you talk about the results and I'll do the
Okay. So, our results, now, granted, I did not put everything and anything in here. I'm trying to just give a little bit of what we're going to present at the NSCA. But at the end of the day, if you look at the null hypothesis, so we use a t-test, and you see that the t-test proves that there was a significant difference between the pre-program one RM test and the post 1 RM test, and under that is our bench press results. Again, proving that it is significantly higher from pre to post.
All right, and then if you can, there you go to the conclusion slide. So just to kind of wrap things up, and again, like Mike was saying, we don't want to give a lot of the information and data out that we're going to have to present at the NSCA conference, but some kind of take-home messages that kind of came out of this study was that BFR can definitely improve your 1 rep max and strength and conditioning program, which kind of speaks to your strength and conditioning aspect. And then Ed, I love the point that you said earlier about speaking from an athletic training standpoint. Your job obviously is to limit injuries and also increase that recovery from injuries. So, I think this study also showed not only does it increases that strength and performance, which in turn increases your athletic performance, and also from an injury standpoint, and we didn't put this in there, but from an injury standpoint, it really helps improve that recovery aspect. And it could assist in terms of long-term degenerative changes throughout the body. So we really felt that this study was something that was very functional to what we all want to do. And again, all is a broad term. Are we talking? We're talking athletic trainers. We're talking strength and conditioning coaches, different things like that. So I think the results really lent itself to those findings. So it was very evident there through the results.
Yeah, and something I'll say too, Ed, just kind of off the top of my head is, these people, our participants, our subjects in the study, we didn't see any patellar tendonitis. We didn't see any Achilles tendonitis. We didn't see any osteitis pubis. A lot of inflammatory conditions that would usually start around week 1, week 2 in a strength conditioning program, from going to 60% to 100%. We didn't see any of that pop up, and I think that's pretty significant in itself.
Yeah, I think there's a couple of things that really stick out with me. Number one is, unfortunately, COVID cut this study short, right? Originally, it was supposed to be 8 weeks. And it also increased our dropout rate. And I know we're going to get beat up a little bit with the scientists in the room about, God, there's such a high dropout rate. Like, yes, now the plan is to repeat this study and do it for a longer period, but still collect the data at the same intervals. So that way we'll have data at 4 weeks again, so we can kind of validate what we found at this study. But we'll also take it out, because a lot of people will say, well, that's fine at 4 weeks, but what happens at 8 weeks, at 12 weeks, at 16 weeks? And the problem with this, for those that are not trying to write studies like we are, is that dropout is very high when you start extending beyond, 4, 6, 8, 10 weeks. And it could be dropout from injury. It could be dropout because they dropped out of school. It could be couldn't make that. There's so many reasons. I can barely make it to the dentist every 6 months. You know what I mean? It's just, it's hard to collect the data. But I really want to commend you guys, because number one, ultimately we're clinicians. We work with people all day long, and to put this kind of effort out to try to advance the field is what we need. And so thank you. From my heart, thank you, because this is what helps us just get better. And of course, any way that I can help, I'd like to continue to contribute. There's something else I wanted to say, but now I can't remember. Ultimately, I'm looking forward to presenting with you guys in Florida. It's gonna be awesome, really fun. We'll have to make it super interesting and engaging, and doing some slides that really show this compare and contrast and highlight where we see the benefits, where we see the pitfalls. And then, the last thing I want to mention is, based on what we found here with velocity, like, I don't understand how you can increase velocity when we didn't do any time-based training. So maybe Thomas is right. Maybe we need to do timed t-tests and stuff and maybe it will benefit. We just don't understand the mechanism. So maybe I'm wrong. If we can increase velocity, but I don't know. And that's just something else that we need to study. Like, we don't know. It's what my brain goes to, but who knows? Maybe there's some other things that we can use BFR for. I'm sure there is. We don't even know. So it's 1:36. I got a patient in 4 minutes. Is there anything else you guys want to say to wrap up?
I want to thank you, Ed, for all you've done in this study, as well as elite form, skip at elite form, and then our strength conditioning coach, our athletic administration being behind us, as well as the masters in athletic training at DSU, and all of our co-authors. Just really appreciate, and last, our football coaches putting that trust in us.
Yeah.
Because you got to think, we're coming off a 6-6 season, and hey, jobs are at stake. They put our trust in us to get our guys and put them in a good situation for being successful on and off the field. And I speak volumes. We went from 6-6 to 10-3, and finished number 7 in the country. So
awesome.
It's great.
Yeah, that's awesome. I'll guarantee your football coach will always keep you on board if you keep your athletes not injured, right? I mean, if you can keep them on the field and get them on the field faster, there's no doubt. Sorry, Chris, what were you going to say?
I was just going to say, I echo that. I know you got a patient, so I'm not going to go through that. But all the things that Mike said, and I want to tell you, all you guys listening and everybody around, how hard Mike and all his staff and athletes worked. I think that made a huge difference. Mm-hmm. And the COVID factor added to the equation. It made it a little bit more difficult. Yeah. But everybody at JSU, whether it's the coaches, the players, the athletes, the staff, and even the people who contributed to the research, really had to work very hard to get this accomplished. And I think it was very well worth it. So I just commend everybody that was involved.
Yeah, it's awesome. And you're going to get rewarded with it, with, getting it accepted by the National Strength and Conditioning Association, which is the premier, in my opinion, premier strength and conditioning organization in the world. And I'm proud to be a member for, that's my first certification. I mean, I took the test prior to graduating. I had to wait until graduation in order to get my certificate. And you can't really see it, but it sits up there with the rest up there. It's one of those.
Ed, I can't even count that high. How many is that? 30? 25?
That's only the start, buddy. You have to go way over here to see, all the other ones. But
I think
it's a Freudian thing. So anyway, thanks you guys so much for joining me during the middle of your day. I really appreciate it. I'm sure the audience has appreciated it as well. And we'll be chatting soon. We got a lot of work to do.
Awesome. Thanks.
Thank you very much, Ed. We appreciate it.
Bye.
Bye-bye.
Thanks, everybody. See you next Tuesday.